Good evening, and thank you for tuning into this town hall for families, which is titled Supporting Children's Emotional Well-Being During COVID-19. This event is being presented by Yale New Haven Children's Hospital together with the Yale Child Study Center, and we really hope to bring you some helpful information this evening. My name is Vicki Smitak, and I'm the Medical Director for Regional Strategy and Partnerships for the Yale New Haven Children's Hospital. I'm also a pediatrician here at Yale, both at our New Haven site as well as at YNHCH Hospital. I would like to share with you that our children's hospital has evolved into a true children's health system over the past few years. And as a result of this evolution, we're now able to provide high quality care to children all the way from New York throughout all of Connecticut and into Rhode Island. So we take this responsibility very seriously. We see it as a great privilege when you trust us with the care of your children. In addition to being health professionals, each of us here this evening is also a parent, and in some instances, a grandparent as well. So we have all felt the stress. We continue to feel the stress, the anxiety, the uncertainty, everything that you all have been feeling these past months, both from the perspective of health professional and also from that of parent and grandparent. So these town halls or webinars are one of the ways that we have decided to connect with our patients and their families. And tonight's topic on children's emotional health during COVID-19 is one that is so timely and is affecting so many. We'd like to thank you so much for joining us. I will serve as moderator this evening, and please know that we will have a question and answer session toward the end of the program. So I would now like to introduce and also to thank Dr. Linda Mays, who is the chair of the Yale Child Study Center. Dr. Mays has dedicated a lot of her time in supporting and sponsoring this event, and we are all very, very appreciative. So Dr. Mays, would you like to say a few words to kick us off?
Thank you very much, Dr. Smitak, and thank you so much to everyone for joining us tonight. These have been very challenging months for so many of us, for families and children across our state. And at the Child Study Center, we want to be available to help you and to help answer your questions. The Child Study Center is a part of the Children's Hospital. We provide behavioral health services for children and families from birth all the way through adulthood through our services for parents. So it is our mission and our devotion to be able to care for children at any time, and especially at these times of need. So thank you again for joining. Thank you for hosting us from the Child Study Center, and I will turn back to Dr. Smitak to introduce my colleagues.
Thank you, Dr. Mays. So with that, let's get into the program. We have two panelists here this evening. We have Dr. Ellie Leibowitz and also Dr. Nancy Close, both from the Yale Child Study Center. Each will give a presentation on their topic, and then we will shift to a question and answer session. So these are some of the housekeeping items so that we can have a really successful program, so that you can get the information you need, and we can get your questions and your comments so that we can respond to you appropriately. So I encourage you to send us questions or comments via the Zoom chat function or through Facebook Live. We also have some of our provider staff working behind the scenes. So if we do get overwhelmed with questions that we can't, that we don't have enough time to cover in the hour that we have, those folks will be helping answer them behind the scenes in written form to you. I will also mention one more thing so I don't forget to do it at the end, and that this is intended to be the first of a two-part series with a second webinar on children's emotional health coming in August. That date is yet to be determined, but we will let you know. So please, in the meantime, send us your feedback, your comments, and keep checking in on our website and our social media sites. And with that, I'll turn it over to you, Dr. Leibowitz.
Okay, thank you very much. It's great to be able to participate in this webinar. Thank you, Dr. Smitak and Linda Mays for putting this together and hosting it. And I'm going to be talking about anxiety in children. We can go to the next slide, and you can see these are the main anxiety disorders, meaning the mental health diagnoses that we diagnose in children. And one thing to know before I say just a few words about each of these, one thing to know is that even in the best of times, when we're not living through a worldwide pandemic with a virus, etc. Even in the best of times, anxiety problems are exceedingly common among children and adolescents of all ages. In fact, taken together as a group, anxiety problems are the most common mental health problems of all. And we currently estimate that approximately 1 in 3 children is going to experience a clinically impairing, diagnosable anxiety disorder at some point by the time they reach adulthood, meaning that these are very common problems. And of course, right now, we're not quite living in the best of times, and we're exposed to tremendous stressors, frightening information from the news, uncertainty about what to expect, sudden changes to our routines and the structure of our lives, isolation from other people that we're used to seeing, peers, friends, extended family, etc., and many other changes that all can contribute to elevated anxiety, even in a child who may not have been experiencing an anxiety disorder previously. And the other thing to bear in mind, and this will also be part of the topic for the next webinar in August, I think, is that part of the challenge is also going to be when we ask children to resume all those parts of their lives that have been somewhat suspended because of COVID-19, meaning that for some children, the challenge is going to be now because they're worried or anxious or responding to everything that is going on. And for some children, the challenge is going to occur when they're actually asked to pick the pieces back up, to go back to school, to go back to academics, to go back to social encounters, etc. Both of those can contribute to elevated anxiety in children. But let's go through quickly and see what do we mean when we talk about anxiety disorders? Because of course, everybody is going to experience some anxiety some of the time, and perhaps in this period, even more than usual. But when we're talking about anxiety disorders, what we mean is that a child or an adolescent, or it can also be an adult, because these also apply to adults as well, is experiencing elevated anxiety in a way that is beyond the normal anxiety that we're all going to feel sometimes. And it's impairing their ability to function normally. Maybe that means academic functioning, school. Maybe it means social functioning. Maybe it means their own well-being, their feeling okay, just the ability to feel okay. And it can also refer to impairment in their daily habits, like can they eat normally, can they sleep normally, etc. And we divide up these different anxiety disorders by the main things that trigger the anxiety and the main ways in which they manifest. So for example, starting at the top of this circle, you can see at the top the phobias. And phobias are really strong, irrational, exaggerated fears of just about anything, because really anything could be the target of a child's phobia, but some things are more likely to be the target of a phobia than others. So for example, common phobias include things like fear of animals, large or small, could be bugs or could be dogs, things like that. Natural phenomena like fears of storms and heights and the dark, fear of needles and injections, things. These are examples of common phobias, but again, a child could have a phobia of anything. And if it is impairing their ability to function normally, if it's getting in the way and causing them to suffer and to not function normally, then it is a clinically diagnosable problem. Panic disorder refers to having unexpected panic attacks. And a panic attack is a little bit like having a wire trip in your brain and finding yourself just awash in these tremendous waves of anxiety that crash over you. It's an intensely unpleasant experience with racing heart, shortness of breath, scary thoughts, feeling like reality itself might be distorting itself around me, or sometimes experiencing out-of-body kind of experiences, or thinking that I'm having a heart attack and dying or losing my mind. It's a brief episode. A panic attack will generally last somewhere between 10 and 20 minutes, and it's not physically dangerous. And this is an important thing to know if you're the parent of a child with panic attacks, that a panic attack in and of itself is actually not a physically dangerous thing. Your body works about as hard when you run a quick sprint as it does when you have a panic attack. The difference, of course, is that when you run a quick sprint, you know why your body is shaky or out of breath or your heart is racing, and that makes it much less scary. But when it happens suddenly and unexpectedly, it's a very frightening experience. And the real danger in panic attacks is not that the panic attack itself is dangerous, but rather that a child may become so frightened of having another such panic attack that they'll start to avoid situations or places where they think they might have a panic attack. And that's when, so panic disorder is just becoming very worried about having panic attacks, and agoraphobia is when you start avoiding places where you think you may experience panic symptoms and you won't be able to leave. Maybe you'll feel trapped there, or maybe it will be humiliating. And so those two tend to go together. The panic disorder and the agoraphobia tend to go together for those reasons. Now, generalized anxiety it really means chronic worry. And it's a little bit like having an antenna mounted on your head and just tuned to pick up everything there is to worry about and then run with it. And so, for example, you know, in day-to-day life, there are so many things that a child might just normally hear or see that might cause them to worry. Like maybe they see something, you know, even when there isn't a pandemic, maybe they see on the news something about cell phones and cancer, and then they start thinking, wow, who do I know that uses a cell phone? Literally everybody I know, all my family, are they all gonna get sick? Are they all gonna die? And you just have these thoughts running through your mind, churning away. And then maybe the next week it's something else that you're worried about. Maybe your grades, are they good enough? Are you gonna succeed? Are you gonna get into the right school? Or maybe your parents have an argument and you start worrying about their relationship. Are they gonna get divorced? Who am I gonna live with? And you lie awake all night in your bed, thinking all these scenarios about how all your life is going to go wrong and all the scary things that could happen. And of course, right now, children are exposed to so much frightening news about COVID-19, and so many of them are going to be preoccupied with thoughts about it, whether that's thoughts about their own health or about their relatives' health, my parents, my grandparents, who do I know? Maybe I already know somebody who has gotten sick and that scares me or worries me. Or maybe they're worried about school. What will my school look like? Will I go back in the fall or will I not go back? Will we have classes or will we not have classes? And these things can really keep a child very worried for a long time. And that's generalized anxiety. It's when you're just chronically worried and you can't turn those worries off. Social anxiety is a kind of painful, extreme shyness. It's the worry that other people are judging me negatively and I'll make a fool of myself. I'll say the wrong thing. People will laugh at me. And it creates such a burden because all of those interactions that would otherwise be kind of fun and pleasant, you can exchange stories, swap jokes, things like that. They're never fun and pleasant because I'm always so worried. Maybe the silence is too long. Maybe I've said the wrong thing. Maybe everyone thinks I'm such a dork, etc., etc. And children with social anxiety can be very lonely, but and really wish that they did have many more friends, but they'll often put a lot of energy into avoiding social situations because of the fear that those situations would go poorly. We're getting close to the end of this circle, but still on it is separation anxiety, which is very common, especially in younger children. Separation anxiety is the fear of being separated from caregivers. Usually that means parents. And it can be the fear that something bad will happen to me when my parents aren't there. Maybe I'll get kidnapped or, you know, or hurt in some way. And it can also be a fear of something that will happen to my parents when they're not with me. Like maybe they'll have a car accident or something like that. And it's not just separation anxiety disorder. It's not just the child who doesn't want their parents to go away for a weekend. It can also be the child who's not able to close the door because they have to keep eye contact with their parents. Maybe even when they shower or use the bathroom, they're afraid to close the door because what if I can't see my parents and then I get scared? Or maybe they can't sleep alone at night because they want to be near their parents. And finally on this list is OCD, which stands for Obsessive Compulsive Disorder. And that's a problem where you have intrusive, obsessive thoughts that come unwanted into your mind, but you can't stop thinking about them, like doubting, did I do that thing or did I not do it? Or thoughts that maybe some harm will occur to me, or maybe even I will do something bad, or maybe I did already do something bad. These like kind of self-tormenting thoughts that come into your mind and you can't shut them off no matter how hard you try. And then along with the obsessions, which is the O of OCD, we have the C of OCD, the compulsions. And those are ritualized behaviors, like extreme superstitions, in a sense, where you have to do things just a certain way in order to make the worry that comes from those thoughts go away. And so maybe you have to touch something a certain number of times, or check something a certain number of times, or say a special word, all these different rituals, which can actually accumulate into a really long time that is spent on the OCD. For example, cleaning rituals, like hand washing excessively, or checking rituals that you might repeat many, many, many times so that it actually interferes a great deal with your ability to function. So these are the main anxiety disorders that we diagnose. But if we go to the next slide, what does an anxious child actually look like? Right? We all, if you close your eyes for a second and think, picture an anxious child, maybe you have some mental image of what that child looks like. But let's go one more slide forward. Actually, anxious children can look like many different things. They don't all look the same. Maybe you imagined a child cowering, scared in the corner, and that is what some anxious children will look like. But there are so many other things so many other ways that anxiety can present, like extreme self-criticism, the child who's always, I suck, everything I do sucks, I'm no good, my work is terrible, I look ugly. That kind of extreme self-criticism can also be a marker of anxiety. Or perfectionism, rigidity and aversion to change, the preference for repetition, for pattern, rather than novelty and change is a hallmark of anxiety. And even anger and irritability are often features of anxiety. Probably most people listening to this now have heard the phrase fight or flight. And that's a very common phrase, I think, to describe the anxious response. So we all know about fight or flight, but we often forget that half of that is fight. It's much easier to look at a child who is cowering in the corner and to think, wow, that child is really anxious, or a child who is expressing worry and think, wow, that child is anxious. And it's harder to look at the child who's having a temper tantrum, or is being physically aggressive, or is having an outburst, or is just really irritable in their mood, and to think, maybe that child is anxious. And of course, not all aggressive behavior in children is anxiety driven, but some is. And children who are maybe out of school or have been out of school because of COVID-19 and are feeling anxious, may be showing a lot more irritability and a lot more anger or temper tantrums in their behavior. And that is not always because suddenly their character has changed to be more negative or they're developing some behavioral problems. It can be because of elevated anxiety. So the thing to take away is that anxiety can actually look quite different in different children. And let's go one more slide forward and think about what effects anxiety actually has on children. What changes when we're anxious? Well, the short answer is just about everything changes when we are anxious. And so highlighted here are 4 domains of how we function, and all of these change when we're feeling anxious, when we are anxious. So for example, our cognition, meaning our thoughts. Our thoughts are different when we're anxious compared to when we are not. And let me just point to, really briefly, to 1 or 2 of those differences in our thoughts. For one thing, we tend to be hyper-focused in our thoughts on the things that make us anxious. So it's like developing some tunnel vision. And that means that it's going to be harder for us to think about other things. Sometimes that can be frustrating for parents because it almost seems like the child doesn't want to not be anxious. All they want to talk about is the thing that makes them anxious. And you want to tell them, like, just stop thinking about it. But of course, they can't choose to stop thinking about it, because our brains are not wired that way. It's like, imagine if you were, standing on the platform of a bungee jump, and you're supposed to jump off in a second. And if you're like me and you don't love heights, imagine that you're standing there on that platform and now someone tries to teach you algebra. Well, it's going to be really hard to learn algebra when you're standing on the bungee jumping off platform because you're so scared. And that means that it's really hard for your brain to focus on other things and to calmly take in information. And the other thing that changes in our cognition, or one other thing that changes, is that we tend to overestimate the likelihood of risks when we're feeling anxious. All risks seem more likely. And so if I am an anxious child and I hear news about COVID, I'm going to think it's a lot more likely that I get sick. Or maybe I'm an anxious parent, and that can also make it seem to me more likely that I'll be the one who gets sick, or that my child will be the one who gets seriously ill, etc. So that's our cognitions. Our physiology changes. Our whole body is different when we're anxious. People tend to focus a lot on the short-term acute physical responses to anxiety, like that racing heart. Maybe my mouth is dry and my palms are sweaty. Maybe my body is trembling or dizzy. Maybe my breath is coming in shorter, shallower breaths rather than deeper, slower breaths, etc. But the truth of the matter is that although those are the more dramatic physical manifestations of anxiety, often the more important ones are actually the longer term chronic effects physically of being anxious much of the time. If I'm anxious much of the time, it means my muscles are tense more of the time. And so I might start to develop aches and pains and stomach discomfort, gastrointestinal complaints, etc. My immune system may get a little bit more run down because I'm not building back up those reserves of energy and resources because I'm so worried. I'm not getting the good night's sleep that helps me to wake up refreshed and strong and healthy because I'm so worried. And so often it's actually the longer term, more chronic effects of anxiety that end up being even more important than those more dramatic short-term effects. And really quickly, our emotions, of course, change. And I've already said that it's not only the feeling of fear that goes with anxiety, it can also be the feelings of rage or anger or irritability. And the other thing to say is that anxiety doesn't only make us feel emotions, it can also make it harder to feel other emotions, meaning it might be harder for me to feel happy or curious or sociable and things like that, or excited because I'm feeling anxious. And this is one reason that anxiety often precedes actually the onset of mood problems like depression, because if it's so hard for me to feel positive feelings and I'm thinking so many negative thoughts, then it can start to lead to the development of depression as well. And finally, on this slide, we have the behavior. Of course, our behavior changes when we're feeling anxious too. We're going to be more avoidant of things. That's what anxiety is there to do. It's there to keep us away from danger. And when we misread what the dangers are, then we stay away from the wrong things. So a child with a phobia will, of course, stay away from the things that make them anxious. And this is also important to think about in the context of COVID-19, because for children who are anxious, even in more normal times, for some of those children, actually, this period may have been a period that was even easier than other times, because maybe going to school is hard for me. Maybe talking in class is hard for me, or doing academic tests, or separating from my parents. And all of those things may have been happening less over the previous months, but it's actually really important that we counter that tendency to avoidance, that we promote more coping and less avoidance in children who are anxious. And so for each of these quadrants, We can think about how can we encourage healthy rather than anxious behaviors. If your child is having a lot of anxious thoughts, we can encourage them to challenge those thoughts with more realistic thinking that is less biased toward anxiety. If your child his physiology or her physiology is showing that anxiety, maybe their muscles are tense, maybe they're physically anxious, we can encourage relaxation, calm breathing, muscle relaxation, find a script online or a YouTube video that shows how to do muscle relaxation or deep breathing, and practice that with your child. If their emotions are showing so much fear and anxiety, we can literally practice feeling other emotions. Let's make ourselves laugh, for example. Let's get angry at anxiety, and then we'll feel less scared, for example. And if the behavior is primarily avoidant, if we're staying away from the things that make us anxious, then let's encourage more coping behavior and facing, maybe gradually and in slow steps, facing those fears. And finally, I know I'm pretty much out of time, but I think this is the last slide coming now. And this is a word really to parents and caregivers and teachers about how we as the adults in the children's lives can respond to anxiety. And I tried to summarize it in as brief a recipe as I could, which is the goal is to support the anxious child rather than to accommodate them. What we mean by that is accommodation is when I start changing my behavior so that my child doesn't have to face their anxiety. Like maybe they're afraid to be alone, so I always stay with them. Maybe they're worried, so I always reassure them. But the goal for an anxious child is to support them rather than accommodate them. And here's the recipe for support. I'm being supportive when I'm showing my child both acceptance, meaning I get that you're anxious. I'm not denying it. I'm not telling you that it's bad or it's weak or it's silly to be anxious. I'm accepting of it. I get it. But I'm also showing you confidence, meaning that I believe that it's okay to be anxious some of the time, that I believe you can handle being anxious some of the time. And that's the message for parents, is try to show your child, talk with them about anxiety, ask them how they're feeling, take an interest. And if they are feeling anxious, show them that you get it. Practice some of those tools that we just talked about, like the breathing, but also show them that you believe that they can handle being anxious rather than trying to change your behavior entirely so that they never have to. And I think that was my last slide. Yes, it was. So I'm going to stop there, and at the end we can come back and take questions, and I'm going to hand it over for Nancy. So thank you all very much.
Great. Thank you, Ellie. And I really love your last slide. I'll say that that last piece, because as parents, we want to do all we can. We feel we're supporting our children when, when in fact, sometimes we are accommodating and not really helping them in that sense. So it's a really powerful message, and it's very challenging, but I think it's an important message to get out there. Thank you for that great talk. We'll shift gears now to Dr. Nancy Close. Nancy is the clinical director of the Parent and Family Development Program at the Yale Child Studies Center, and she's going to talk to us about regression in children. So Nancy, thank you for joining us, and I'll turn it over to you.
Thank you so much, Dr. Smitek, and thank you, Ellie, for such a wonderful presentation. And I think a lot of what Ellie says will be echoed here in what I have to share with you. So next slide, please. So I'm talking about regression in young children, thinking children 0 to 6, although even older children, even adults, have moments of regression, moving backwards in our lives. But I'd like to start off with the idea of progressive development. And imagine a little toddler just learning to walk, and or they've mastered it, and the child's hands, there's a big smile on his face, his hands are out in front of him as if to say, here I come, world, look at me, look at what I can do. And I think that really speaks to the fact that children are very much motivated to move forward in their development. They're motivated to explore and manipulate and master their world, and seeing the joy and the pleasure that children experience when they do accomplish something is really exciting and wonderful for parents to experience. I think we should also remember that those very early years of development, there's so much going on. Children are learning to talk, to express their thoughts, to play, to get along with others. And so on the next slide, we can think about regression. I mean, we certainly should be concerned when that drive towards forward development is absent, but I think it's also very important to remember that regression is a very normal and natural part of development. And it can occur right before, say, a child makes a developmental leap forward, or it can also occur after the child has made that leap forward. It can also occur in response to stress. I mean, normal everyday stress. And now as we're living through COVID, the stress, the external stress is much more intense than it is usually in a young child's life. But what about that internal stress? So when young children become overwhelmed by typical developmental conflicts, like, do I become a big kid or do I stay a baby? Do I share my toys with my friends or do I keep them to myself? Do I use my words to tell my friend I don't like something she did, or do I hit her? Is it okay to have big mad feelings? And so all of those kind of internal conflicts can also lead to some regression in children. So next slide. So what are we seeing during COVID? What am I seeing in the clinic? What am I hearing from my colleagues who have young children? We're seeing things like children who talk fine, beginning to talk like a baby, children who are having sleep challenges, maybe children who've just became toilet trained before COVID, having some toileting issues. Children having really strong feelings and having difficulty coping with them. So anger, sadness, anxiety, frustration are really difficult for them to manage, and maybe more so during this stressful time. But typically, it does happen even when there isn't the external stress of COVID. We're seeing a lot of temper tantrums and a lot of behavioral challenges. And the thing is, you know, I think when parents see this, it really does up their worry and anxiety about, is my child okay? What can I do to help and support him or her? When is this going to end? I can't take a temper tantrum every day very much longer. And so I think knowing that, you know, the regression is really a communication, and some of the temper tantrums and strong feelings and changes are all very, maybe not so clear communications, but important ones to pay attention to. And really, children do as well as the adults who care for them are doing. And we, I think, as parents have been really, really challenged during this time. And on the next slide, we can see what some of those challenges are. Really feeling overwhelmed and pulled in multiple directions. Some parents are out of work and facing financial challenges. Many parents are juggling working at home and having their children at home, and feeling responsible to do homeschooling, as the schools are sending out packets for the children to do, have Zoom sessions for the children to participate in. And early in COVID, when the schools shut down, there was a flurry of information on the internet about how parents were doing teaching. And many of the parents were really bragging about how well they were doing and how exciting it was to be teaching their children. And it made the parents who were feeling really pulled in multiple directions, really even more overwhelmed and worried about what they were going to be able to do to support their children and keep their job. Resorting to putting on videos. I mean, I've heard many parents say, you know, we kind of threw the guidelines about videos out the window, and I know we're using that too much, but what do I do when I have a Zoom meeting in the middle of the day and I don't have any childcare, and my partner or spouse is not available to help out. So, and then guilt, I put that in capital letters. I mean, I think feelings of guilt come with parenthood, no matter what. But it is, I think, at a very high level. For parents who need childcare, finding and affording childcare, very few childcare centers in this area have been open. Some are beginning to open now, but at a much reduced enrollment. Then there's the worry about exposure of themselves and their family members and staying healthy. Many parents have lost loved ones to COVID, and then it becomes really difficult to hold on to hope. So the next slide, please. So thinking about ways in which we can support children's emotional growth and expression when they are showing signs of regression. I think number one, it's important to know that there is a natural motivation to move forward in development, and it is strong in children. And in most cases, it will emerge again and bring them much excitement and joy. But I think what we have found is the idea of, as a parent, maintaining a reflective stance. And what that means is really trying to make sense out of one's child's thoughts and emotions. And it doesn't work to say, you know, tell me how you're feeling or why did you do that? It really helps to be curious and wonder about what might be going on, and to really spend time watching and wondering and maybe figuring it out. One of my teachers, Dr. Sally Province, said, don't just do something, stand there and pay attention. Your child is trying to tell you something. And so being able to make connections between a child's feelings and behaviors, we're not going to really always know what those connections might be. But if we notice that our child is struggling, being able to say something like, gee, I noticed you're using a lot of baby talk. I wonder if it's feeling too hard for you to have all these changes happening. You can't see your friends at school. You don't really want to go on the Zoom because it makes you sad to see your teacher because you miss her so much. So making those connections, I think, can be really helpful. I'll give you kind of another example. I was called in to consult to a child care center where a almost 3-year-old little girl was really being aggressive towards her friends, and the teachers were worried about her, and they asked me to come in and observe. So I came to observe her she was visiting a classroom that she was going to transition to. She was with her teacher, she was with some friends, and she had a wonderful time. She was playing, there was no aggression. She, when it was time to leave, she was really sad about leaving. She started to have a little temper tantrum, but her teacher helped her calm down. And she had never met me. And I was walking down the stairs with her, and I said, you were having so much fun in there, and you really didn't want to leave, did you? And that made you mad. I didn't say anything more than that. And she was just kind of walking down the stairs. She gets in the classroom and she says to her teacher, pointing at me, she said, I want that lady to change my diaper. And so there was a moment where she felt understood and maybe some relief from that. But it wasn't, it wasn't anything deep that I did. I was just really commenting on what I thought might be going on for her. We don't always get that. So I think also understanding that our children's feelings sometimes are similar to ours, but also sometimes they're very different. Understanding that our feelings, how we're doing, can really affect our children. Even if we try to hide them, they kind of have radar for finding what the real feelings are. Understanding our role in helping children to regulate their feelings. We have a big role in that, and sometimes we have to regulate our own before we can be supportive. And it's that capacity to regulate ourselves that begins to teach children how to do it for themselves with our help and scaffolding. And then also understanding development and the impact that it has on the child's capacity to express and cope with feelings and manage kind of regressive behaviors. Next slide. So supporting children when they're showing signs of regression, help with building coping muscle. I think Ellie gave some really nice ideas about that. Kind of confidence that they will be able to do that. I think sometimes when children are regressed, we can become really worried. And so we hover, we want to fix it for them. We want to do everything that we can so they don't become overwhelmed. Whereas what we need to be doing is helping them with that coping muscle. Communicating to ourselves and also our children that it's normal to feel anxious and worried during this time. I think it's also important, if we are picking up on that, to wonder with our children if they're having questions about what's going on, questions about school, questions about why they can't be with their friends. I think many parents have done a really nice job, and there were really supports out there to help parents talk to children in a developmentally appropriate way about COVID. I said before, it's really important to regulate yourself. They always tell us on the airplanes to put on our breathing masks first. Well, we need to do that in parenting with our children. And then also knowing that regression, for the most part, healthy regression is normal and is an important process to support progressive development. And next slide. Other things, it requires a lot of patience and empathy. I think balancing between being kind and firm in the limits that we set and the expectations that we set for our children. I think this is really important, especially with young children who tend to be very egocentric. So talking openly about the stress that everybody's feeling, and to be sure that they know that they're not the cause of the stress. If mom or dad is irritated because the child's asking for lunch, but they need to get a project off before lunch, letting the child know that they're not really the cause of the stress and they're not the reason the parent is feeling frustrated or angry. For the most part, I mean, there are times when our children really do infuriate us. It's important also to know that for very young children, make-believe, imaginative play is a way for them to gain control over frightening events, strong feelings, or experiences. And so it can be really helpful to watch what your children are playing about. I think it gives you a window into their internal experience, which I think can be very helpful in terms of understanding your children, but also helping them navigate challenges. I also want to say the struggle is okay. It really is, I think many parents feel that they don't want their children to struggle. They want it to be smooth sailing, but it really is through struggle and conflict that growth and maturation happens. So knowing that it's okay, I think, can put our minds at ease a little bit. And then, as I said before, be sure that children know they can ask questions. And maybe you won't, sometimes they ask questions that are really big ones, and you think, how am I going to answer this? It's always okay to say, that's a really big, important question, and mommy or daddy has to think about that a little bit before I give you a good answer. It's also helpful to say, well, what do you think? Because sometimes what we think they're asking and what they're really asking about are two different things. So we want to kind of make sure we understand the questions they're bringing up. And then the next slide, which I think not quite. So when to ask for help. Certainly if the regression is prolonged and interferes with progressive development. I think during this time, regression is a bit more prolonged. I think if a parent's worry feels intense and it's difficult to regulate around the child's regression, I think that's a good time to ask for help. If the regression causes the child to lose interest in play and peers, that would be another reason. And then if it interferes significantly with daily activities. But with most normal regression, it gets back on track with support and scaffolding from parents. And certainly things like, you know, having a new baby in the house or starting a new school or being separated from a parent, those are all experiences that can cause some regression. And I think next one is the last. Next slide, yeah. So these are just helpful tips that come from an amazing psychologist who works with children who've been exposed to trauma. But important to pay attention to yourself physically and mentally. Don't let perfect be the enemy of good enough. There's no such thing as a perfect child or a perfect parent, so we need to give ourselves a break. Knowing and appreciating that not everybody does parenting in the same way, and that it is important to value and appreciate and honor the ways in which you and your partner agree to go forward in parenting. So really appreciating, that's especially hard when there are many parents who brag about the ways in which they're doing everything perfectly. And sometimes that's really hard to take. Remembering we can't do it all. And finally, the first affect to regulate is your own. So I will stop then and think we'll have some time for questions.
You know, comment you made about just going easy on ourselves, and that, you know, forgiveness of ourselves in certainly under these circumstances that we're all struggling with. And you know, kind of chuckled to myself, as I'm sure many people did, you know, thinking about juggling Zoom meetings and having, you know, 2 teenage kids at home on certain days, homeschooling, and trying to find space in the house where, you know, I can have my meeting and they could individually have their own school sessions. I mean, that was an interesting hurdle, and a lot of us are going to be dealing with that again, or some permutation of that in the fall. I think we'll probably spend some time in the August webinar talking about some of those challenges. But it does help a lot to call it out and to say that everyone is, you know, sort of in that same boat, and children, you know, although they're resilient, they also struggle with a lot of these thoughts and anxieties, like Ellie pointed out. I have a question here from that was sent in, and it speaks more, I'm assuming, to a school-age child or an adolescent. And it says, I'm worried about my son. He's staying home all summer, playing too many video games. How worried should I be about his lack of socialization? Now, you know, either one of you, and I know how I feel about this, having a 13-year-old son who has played more video games in the last 4 months, as I'm ashamed to admit openly, but, you know, here we are, right? What would you say to that?
I think, Nancy, you might have thoughts about this too. I would say, I think you have to consider the context a little bit. In other words, I would think a little bit differently about a child where this child has always had difficulty socializing, has always preferred maybe to avoid other people and watch the video games, etc., versus a child who's showing a difference in their behavior now. And I think it's different. And it's hard to talk about pros and cons, so to speak, in this context, but in a sense, there are important differences. For the child who historically has not had difficulty socializing with other people, then in the one hand, it's a little bit more concerning. Why this change? What's going on? And we should be curious about that. We should be curious about what is it that they're avoiding now? Is something wrong? Are they less interested? Is it just that like doing it over Zoom just doesn't feel the same? And so they don't, you know, that we should be curious about it. But on the other hand, we can probably also expect that as life returns a little bit more to normal, the likelihood is that that natural tendency toward being more gregarious and outgoing and wanting to be with other people is likely to return as well. So we should be encouraging it, but maybe a little bit less concerned. On the other hand, for a child who has always shown the same tendency, so on the one hand, it's probably not all that worrying that they're still showing it now, because that's kind of like, we know this kid, that's who they are, and we can expect to see that. But on the other hand, we also don't have reason to expect that it would independently and spontaneously change. And so we should probably be thinking, what can we do to encourage more? And more doesn't have to be, not everybody has to be the life of every party. There's a very broad range of normal for social behavior. And some people who are themselves very much extroverted, for example, sometimes forget that not everybody is. And it's okay if your child is not a huge extrovert, but it becomes a problem when they're not able to function as within that broad range of normal. And so I would say we should be curious about what's going on. We should be non-judgmentally and non-critically speaking with the child. And sometimes the child doesn't want to speak to one person, maybe they'll want to speak to someone else. You know, sometimes mothers tell me a child doesn't talk, but actually it's that they don't talk to you. And that's okay. That's, you know, I'm a dad too. And I wish that I asked my kids, you know, how was school? And they gave me rich, wonderful, long answers. But a lot of times all I get is fine, or nothing, or things like that. And that's okay, but maybe there's somebody else that they talk to a little bit more. So we should be taking that interest, but we should also be thinking how to encourage a little bit more. And sometimes that does mean limiting the video games to some extent. You know, if you want your child to eat healthy food, you don't sit them down in front of the table, put a bowl of healthy food in front of them, and also a giant plate of candy, and say, I really wish you would eat the healthy food. Because you understand that when the candy is there, you're not really giving them a choice at all. The impulse to do that is so strong that it's almost not really a choice at all. So it doesn't make sense to be frustrated that they're not choosing the healthy food when the candy's right there. Sometimes we have to take the candy bowl off the table. And so it's fine to play video games sometimes, but maybe there should be times when it's not an available option, and maybe even be bored for a while. Parents don't like to see their kid be bored, but maybe it's okay to be bored for a while, and out of that boredom might come some other choices for things that they might want to do.
Yeah, I think that was a really good answer. Nancy, give us your perspective.
Well, I think of middle schoolers. I know the middle schoolers that I worked with were really dreading going into lockdown because they're so, they so want to be with their friends and they so want to be together. And so I think for many of them, it's been very painful. And so I could imagine somebody wanting to retreat into something that maybe they could share about, at least talking, well, I got to this level on that game, and have you tried this yet? So, but also it also makes me think about that, makes me think of the circle of security, which talks about really you need to, as a parent, you need to be bigger and stronger, but also wiser and kind. So as Ellie says, setting those limits and setting them in a way that, you know, your child knows you mean it, but you're not really going to kind of get into a fight or really be mean about it or punishing.
Yeah, and I think also I'll throw in my 2 cents in saying, going back to the guilt comment that you had made earlier in your presentation, Nancy, because especially during these times in quarantine and COVID, and we just feel so bad for them that I mean, I find myself, you know, bending, you know, certain rules that, you know, are really around screen time and things like that. Because you figure like these poor kids, right? But I think we have to sort of reset our limits and be firm but kind, like you said, and it really kind of shifts it back to a more normal balance. I have another question here. This is a good one. My son missed his friends terribly in the beginning, and now he doesn't much care to see his friends. Should we be concerned? Either one of you want to grab this one?
I mean, I think anytime there's been a separation from parent or friends, I think that there's always a little bit of reluctance to see them again and maybe feel a little shy. Will they, you know, will we still get along? Are we still doing the same things? I've had feelings about missing this person. How do I manage those? What if I get to see my friend, but then, you know, then we go into lockdown again? That's going to be too hard for me. And so I think there are ways of encouraging that. You know, many families are doing getting together in like social pods, that, you know, families that have really quarantined, and so getting together in a socially distant outdoor way where it's just not one child with another child, but a couple of children and some fun games to do in a relaxed environment. I think that typically they would get over that, you know, initial reluctance or shyness around, you know, what's it going to be like. Ellie, what do you think?
I agree. I think in a sense, the short answer is probably not to the question of, do I need to be concerned? Probably not. And probably as they do reconnect, they'll probably, if they like, you know, if they were upset to be separated from their friends, they'll probably get back into the swing of things. The only maybe little asterisk to put is, ask yourself, is this the only thing they're losing interest in? If it's part of a much broader pattern of, well, yeah, they've lost interest in their friends, they're also losing interest in just about everything else, then I might have a little bit more concern. Is this child really feeling okay? Is their mood too low? Are they feeling sad or frustrated or discouraged? And then maybe that's showing through. So if it's like, you know, think of what are the things that usually make them excited? Is it a movie they like to see? Is it a new game that they play? Is it riding their bike? Is it maybe even a video game? And if the answer to all of the things has suddenly become, it doesn't matter, then I have a little bit more concern is this child really doing okay? But if it's just around the friends, probably the answer is you probably don't need to be too concerned.
Great, thank you. I think we'll take one more question because we're coming up to the hour, but I like this one. I think this one is relevant to pretty much any age group. And Nancy, maybe I'll shoot this over to you first. How much should I be talking to my kids about COVID-19?
That's a really good question. I think we never want to overwhelm them with information. I think it's important to check in with them and see how they're doing. With very young children, it's important to keep them away from the news and hearing about the spikes and the deaths and everything else. So I think it's kind of an individual it's individual way of thinking about how I'm going to talk to my child. If you have a child who's always asking questions or is afraid to go outside because they might get COVID, you know, with a child like that, it's probably important to talk about, you know, we're really being safe in our family. We're washing our hands. We're healthy. Your doctor is there to take care of you if you get sick, but this is something that the grown-ups are really going to help you with and protect you from. So really providing that protective shield for them, I think is important. So while we might want to kind of flood them with information because, you know, having information is having some power and control, they need some so they have that power and control, but they don't need to be overwhelmed with it. It's kind of like when a child asks a parent how babies are made, and the parent thinks they have to give every single detail. That's usually not what certainly young children need, and they usually have a specific question about it. But I think it's important for children to know why we're staying home and why we're wearing masks. But for the young children that I know, they talk about COVID, they talk about the virus, they talk about wearing masks. So it is something very familiar to them. And I think there's some really good resources out there for how to talk with children without giving them too much info.
Yeah, I think those are all great points. And Ellie, I would imagine, for a child who has underlying anxiety disorder, it probably is, the advice might be a little bit, more, individualized or a little bit different. And it'd be interesting to hear a little bit, more about that. And maybe we can cover that in our next session because we are at the hour. So I apologize to cut this off because I knew this would be a topic that we could probably spend 2 hours talking about tonight. But this is all the time we have for right now. So I do want to thank both of you so much for participating and sharing all your wisdom and your experiences with all of our families tonight. And I want to thank all of our families and friends and supporters who tuned in to this webinar. And we will make sure we get back to you with answers to any questions that have been left unanswered verbally this evening. We'll get back to you, and we will also get back to you with a date for our August webinar. So thank you all. Have a great evening and stay safe.
Thank
you very much.
Thank you for having us.